Hi everyone, I'm Emily. I want to explain to you how you can release an upper trapezius trigger point. So it will usually be around this area here. It's a very common trigger point. It usually can cause what's diagnosed as tension headaches or migraines. You can release them on your own without the use of anti-inflammatories or muscle relaxants, and you don't have to pay a massage therapist to do it. It's very easy. I will give you all my links below. I'll just show you what a trigger point is a hypersensitive area of contracted muscle fibers, and those fibers refer a sensation to another part of the body. Now, they can be referring sensation with or without having to touch the pain. So we're going to be working with the upper trapezius trigger point today. Usually, if there is contraction there, it would restrict lateral flexion to the opposite side and also rotation to the opposite side. So you might be experiencing that where you can't flex and you can't rotate. It's very common. I'm going to show you on the chart. So as you can see, these X's are where the muscle fibers are contracted. And then this orange area is where the areas that are affected. So you might find that you get set pain or sensation on the affected side that travels in an arc behind the ear. You might experience a headache behind the ear on that side, or a temporal headache on that side that might even travel into the eyebrow. You might even find that you are experiencing pain at the back of the head on the affected side. You might even have pain that goes deeply behind the eye on that affected side. And you might even experience sensation into the teeth or the jaw on that affected side. Now, sometimes we're affected on one side, but sometimes it could also be on the other side too, which is very common, especially if you're looking down at computers, iPhones, if you're in a job where you're having to lean forward, pick things up, if you have a head forward posture, desk sitting posture, anything like that. So I'm going to give you some really easy tips that you can do at home to release this on your own, okay? And you can get rid of this type of headache in a matter of minutes. I have worked with people that have had migraines for a few days. Migraines. So self-diagnosed, usually the doctors diagnose a migraine because they don't really know what the cause of it is. There could be various causes, from magnesium deficiencies to hormonal fluctuations, or it could be we need to clear out the liver, or there's so many different reasons for migraines or headaches, but a majority that I see are caused by myofascial tension. So it's so easy to get rid of them. So one case in particular, a girl had had headaches for a few days. Her birthday was coming up. She was just taking anti-inflammatories and just went over and visited her, and on the bed and just helped release a few points. And it took me 15 minutes. You could do it yourself. It's not magic, although it kind of is. And she felt so much better afterwards. There was another case of a woman, mid-30s, who was a violinist. So she was used to having this certain position of her neck. And so she was still experiencing headaches into her mid-30s from when she was a young girl. So in an hour and a half, I worked on all of these, this postural dysfunction, and she just started sending me her whole family, all her kids, everybody, because she just thought it was a miracle. So I'm telling you that this can work if the cause is myofascial tension. Okay, so I'm going to give you some practical tips. Trapezius self-massage technique. So the first thing we need to do is the upper trapezius is running up here. Most people are tense there. So the first thing we need to do is put the muscle into a relaxed position. So bring the head to the affected side and turn the head towards the affected side, okay? Then the muscle should be quite relaxed. You can do this sitting like I'm doing, or you can do it lying down on your back. What you're going to do is just strum the upper trapezius muscle, and you're going to find a taut band within that area. When you find that taut band, you're just going to pinch a grip, stay on that area. Now, when you find a sensitive point, it may refer up to the head like I've shown you. That means it's an active or latent trigger point actually. An active trigger point means you're getting the headache without even having to press. A latent trigger point, you have to press it to get it to refer. Now you want to release this point. So for example, I press, I feel a referral sensation. I'm going to breathe, maintain the pressure on that point until the sensation I'm feeling going up into my head goes away completely. When the sensation goes away completely, I'm going to move slightly to find more affected fibers. Now we know that a muscle fiber that's contracted will shorten and thicken. So it's going to tighten that strand. So that's what we're looking for. We're strumming along the muscle to find the tight strand, and then we're going to press along it. Does that make sense? Okay, so then we're moving to another area. We press it. Oh wow, it's traveling up. Breathe again until it dissipates. What you'll find usually is that the sensation, sometimes it's very strong. You'll feel the connection, might be like a line going up into your head. Other times it might be more diffuse. And we just wait and breathe and just observe that the sensation just kind of lifts away. Sometimes it will lift away, it'll come back, lift away, come back. We're just waiting for it to go away completely, okay? And then you move to a different area. You strum along, find the tight, sensitive area, press on that. You might feel that connection going up. Good, that's what we're looking for. Breathe, relax, and allow the sensation to go away. Very easy. So this is how you release your upper trapezius trigger point using a lacrosse ball. You can buy that very cheaply at the sports store, or I give my clients these little balls, which are a little softer but still quite firm enough. So come over to a wall on the corner. You're going to locate that tension where you know it's contracted, there's a painful area there, and you're going to come over to the wall like a 45-degree angle. You're going to bend your knees and make sure your back is flat so you're not hurting your lower back. And here you're just going to be relaxing your arm. Your arm is not doing anything. The pressure is coming from my heel into the wall. So it's just like I'm just kind of squeezing that area. Now I can add an added light stretch of the neck. So just my body weight is moving into the ball, into the wall, giving my upper trapezius a little squeeze there. And then I'm using that resistance to stretch my neck. You see, very easy, no effort required. This should be very comfortable and feel very good. So here you can massage it. You could move around like this, up and down. You could move along the muscle like that, or you could simply just stay on the point and relax into it until, again, the pain goes away. If you feel the trigger point pain referral into the head, great, you found the exact spot. You want to breathe with it and let it go away completely. Does that make sense? For this one, you can release your upper trapezius trigger point with a Theracane. So you can buy these on Amazon really cheaply. This is an old chiropractic tool that is probably going to be one of your best massage tools besides the lacrosse ball and besides the rad ball and the 10-pound medicine ball. Okay, so with this one, you can use it here by just finding the trigger point with the knob, relax the muscle, find the point, and then you can just sit on it. Now, my hands are relaxed and just using gravity to weight the tool onto the point. So if you haven't found the point, just move along there until you find it. Some techniques are going to work better for you than others, okay? So this one is quite comfortable to do. Now from here, once I've found the point, then I can stay here, or I can use the resistance of the tool again to kind of stretch my neck away. Okay, that might feel really good for you. Just breathe deeply, relax, and stretch away until there's no more sensation going up into your head, okay? So this is a simple stretch for the upper trapezius muscle again. So what you're going to do is you're going to sit on your hand, palm facing down, and you're going to rise up out of your spine. So, you know, that just brings my shoulder down. And so from here, just weight your head to the side. So you're not going to ever pull, you're going to more guide your head. So I'm just going to be guiding into a lateral flexion of the opposite side. You're just going to breathe deeply and allow the tension to release. You might stay there for, say, 3 to 5 breaths. And then you can angle your head to where you feel you have the most tension. So wherever you find the most tension, you stay there for another 3 to 5 breaths. Okay, so you can do this type of movement. That might feel really good for you. And then of course you do that both sides. Now there's another exercise you can do too, where you can strengthen the muscles of your neck. Now I would do this very gently. So you can again bring the hand up onto your head, gently stretch to the side, and then you can add a P and F stretch into it. So you can kind of resist your head up into your hand, 2, 3, 4, 5, and then you relax into the stretch again, okay? Keep your hand where it is, and then you're going to push your head up into your hand, 2, 3, 4, 5, and then release. Now you can do this at different angles. You can press your head back up into your hand, 2, 3, 4, 5, and release. And again, pressing up into your hand, 2, 3, 4, 5, and release. Now the P and F stretching allows you to gain more stretch in a shorter amount of time, but you don't want to go gung-ho because you can strain your neck, okay? So be really gentle with that one, okay?